causes of frequent urination in men and partly in female. I'm going to talk about the female too, but you need to know about causes of frequent urination. Do you always have the urge to urinate? Okay, I've been having this question, so I'm going to address it in this video. Please listen attentively. Okay, so number one is this: if you drink excess water, if you drink too much water, if you drink any day you're well hydrated, it's normal that you urinate. So there's no two ways about that. Okay, when you're well hydrated, you urinate very well. But here is where the problem comes in. Now, if you feel you're feeling feverish, okay, if you're feeling feverish and then there's this urgency to urinate, like before you get to the toilet, sometimes you might have even peed on your body, or sometimes it's as if you want to urinate plenty urine, and when you get to the toilet, just a drop that will come out. That's where you know that there is problem. Okay, so it's about the urgency and the frequency of the urination. And sometimes when you are urinating, it's paining you, the urine is painful and it's as if it's burning. Okay, this is a likely symptoms of urinary tract infection. Okay, so number one, I've mentioned if you're well hydrated, you're drinking water. That's number one causes of frequent urination in male and in female. Secondly, UTI. This is also can be seen in also the female. Okay, but urinary tract infection, when the urine is also smelling, when it's the urgency, when you're having fever and the urine is painful, it could be UTI. So you just meet your doctor. The third cause of frequent urination in male and female now is there are some drugs that can cause this. Okay, like diuretics. For people that are hypertensive, or there are some drugs that they'll be giving to you, you end up urinating and urinating. So review your drugs with your doctor. Find out if there's some certain type of drug you're taking. Okay, and another one is diabetes mellitus and diabetes insipidus. These are two types of diabetes. Okay, this can make you want to urinate. In insipidus, there's an absence of a hormone that makes the kidney reduce water urination, ADH. When this hormone is dysfunctional, somebody can urinate. So remember all this thing I'm telling you. So this is why you should meet your healthcare provider. If you're not taking too much water and you're urinating, okay, you should meet your healthcare provider. Another cause is BPH, when the prostate gland is compressing on the ureter. Is a tube that allows the urine to pass out. So when this happens, it irritates the bladder. It makes the bladder, any small thing you want to urinate, the bladder is irritated. This is a male. Prostate gland being enlarged, it's presses on the urethra, which is a tube that carries urine out of the body to the exterior. Okay, when it presses on it, there's blockage of urine, and this will now make the bladder to be irritated easily, and then you'll be having the urge to urinate. When you go to urinate, you will not even urinate anything. The bladder is not full, but you are having the urge. So that is another possible cause of frequent urination, which is why you should see a doctor. Don't ignore all of these things. We make these videos online so that you will see your doctor, not to ask people for prescription. Most of these people you see online, they are not even certified. Okay, so if you're noticing these symptoms, you just need to see your doctor, especially for men. Now, another cause also for women is pregnancy. Okay, frequent urination, it could be pregnancy when the baby is pressing on the bladder too, almost the same thing I explained. Okay, so this is another cause of frequent urination. Okay, yes, another cause is kidney issues. Okay, kidney issues. Most of the times, the sign of kidney failure, I've made a video on that. You can go and watch it on my YouTube. Signs that your kidneys are failing. It can be frequent urination and then reduced urination. There are two. Okay, so because in the times of frequent urination, sometimes especially in the night, before you go to the toilet, you're already peed on yourself. Okay, this is another cause of frequent urination. So please, in what you're going to get in this video, especially for the male and female, is UTI, and remember, urinary tract infection, diabetes mellitus, where there's excess sugar in your body, and because the sugar is too much, the kidney is trying to remove it out through the urine, okay, which is why you should see a doctor. Diabetes insipidus, the one that the hormone is not there again, it makes you pee. The hormone that controls water is not there again, makes you pee. Pregnancy, prostate issues, when the prostate is big, pressing on the urethra, and what else, drinking excess water. If you're well hydrated, you urinate. So if you're looking for all of those things, please make sure you see your doctor. Okay, if you're seeing all these things where I say you're having fever, urine is painful, and lot of things I mentioned, see a doctor. Okay, see a doctor. It can be diabetes, it can be anything. Okay, please make sure you share this video to create more awareness. Not only you, most people are not following me, and drop your questions on my comment section or on my Facebook page, and then follow me on YouTube for more educated